Well, I guess I do.
All right. So it looks like we're recording.
Recorded. Yeah.
Okay. My name is Janine Taylor. I'm with District Health Department number 10, and we're going to get started with another round of updates and questions and answers for schools. So Dr. Morse, if you want to go ahead.
All right. Thanks everybody for joining me. I'm going to start today, and I'm going to try to start every call by going over everybody's COVID activity. So I'm going to try to share my screen here.
While Dr. Morse is pulling up her screen, again, if anybody has questions, feel free to put them in the chat box and we'll address those as soon as she's done giving the update. Thank you.
My goal, I'll scroll through these indices and then we'll share them out. I have some other things that I want to get out to all of you after this call. And unless anyone has objections, I think we can probably post these on our school portions of our websites, and then each week I can update them. That might be the most efficient way to keep everybody up to date with their county COVID activity. Obviously, if there's issues in between calls, we can certainly discuss that. So we look at two main things. One is the percent positivity of test results in your county. The other is the number of cases per million in your county. We were supposed, can you see my screen, Janine?
Yes, I can see it.
Okay, just want to make sure. We were supposed to have finalized metrics or matrix to us from a collaborative effort from local health and the state yesterday. Okay, I got muted, so I unmuted myself. So anyway, those final
Sorry about
metrics
that.
are not, that's okay. So anyway, get myself back on track here. So those are not finished, unfortunately. Hopefully they'll be finished very soon. But basically, I have an idea of what those metrics are going to look like. So kind of giving you an idea based on that, how everyone's looking. So to get rolling, I'm going to go through the percent positivity for everybody and then the total cases for everybody. So to start with, the state as a whole is at 3.3% positivity, which is in the medium risk category. So this is a 7-day average. So this is kind of the average for the last 7 days. Lake County is at 0%. On the 13th, it was at 5.6%. So just to know that, again, this is a rolling positivity. I'm going to try to enlarge this a bit. I did paste what your graph is like, so you can see that here. This goes all the way back to March. So it's kind of tiny, but it's here for you, so you don't have to go hunt through the website for that. Manistee is at 0.3%. Gratiot is at 0.6%. Mason is at 0.7%. I did put these in order for you. So Osceola is at 0.7, Mecosta is at 0.7, Gladwin is at 0.7, Montcalm is at 0.8, Roscommon is at 0.8, Aranac is at 1%, Missaukee is at 1.2%, Kalkaska is at 1.4%, Oceana is at 1.4%, Clinton is at 1.5%, Crawford is at 1.7%, Nuevo is at 1.9%, Wexford's at 2.7%. And they've had a little bit of a bump here just recently. Clare County is at 2.9%, and that's right at the cutoff for low risk going into medium risk. So the 3 to less than 7% positivity is considered medium risk. Isabella County is at 5%. Again, on the 18th, they were all the way down to 1.6%. As many of you know, we've had a huge jump in cases in just the last week, which has been completely due to CMU students. So as we look at that and we look at the risks for return to school for our K through 12 students, we would discuss that likely will not impact that demographic, since the odds of K through 12 students and their parents and teachers coming into contact with those individuals is quite low. So again, that's where we have to look at those numbers and the facts behind that. We have no counties right now that are in the medium high risk group, the high risk group, or the very high risk group for percent positivity, or the highest group. So we have a lot of different groups here. So we're going on now to the cases per million. The state as a whole is in the high risk group. We have 49.6 cases for every million people population. So we were up in the 66.4 range around the 11th. So you can kind of see looks a bit like a roller coaster here. So we're trending down right now. So our counties that have less than 7 cases per million, which is the low risk group, Lake County, but again, note, it's been a bumpy ride. There were 85 cases per million back on the 11th. Note that because the population of Lake County is small, 85 per million equates to one single person within that week. So again, taking those things into consideration, Osceola, the rate right now is at 0. Montcalm is at 6.8. So the next group is 7 to less than 20 cases per million, which is medium risk. Missaukee at 9.5, Crawford at 10.3, Mecosta at 13.2, Kalkaska at 16.4, Gladwin at 6.9, Manistee at 17.5. Just pointing out that, a couple of weeks ago they were at 40.9, which again, for them, that is one person. So keeping that within a grain of, keeping that in perspective there, but they did have higher numbers a couple of weeks ago. There were a couple of clusters there. Newaygo is at 17.8. A couple of weeks ago, it was at 65. Aranac is at 18.8. So that's the medium risk category. And that would be business as usual for schools. The 20 to less than 40 cases per million, we have Clinton at 25.7, Gratiot at 27.8, Clare at 28. They were just recently at 67, and it has dropped off just recently. Mason at 29.7, Roscommon at 35.9, and that would be in-person education. Again, the percent positives are quite a bit lower risk category, and so I wouldn't really have concerns about these case numbers. In the higher group, Oceana has 43.3, but again, given their population, that is basically one case. Wexford has had a recent jump. They're at 56.1, but just a couple weeks ago, they were only at 12.9. We don't have any in the very high group. Again, Isabella is in the highest risk group. I think that's the only county I've had that's ever made it to that category. We've had over 100 cases in the last week due to CMU. So just to keep it in perspective, back on August 4th, there were only 8.1 per million, so very, very low. Then 10 days later, it was up to 44. And then on the 21st, so less than a week ago, our average was 207.9 per million. So that's basically 14 cases a day. So again, just to keep it in perspective, you can't just go on numbers, you have to look at what's behind it. So again, assuming this is helpful and that you don't mind having this posted on our forward-facing website, we'll share this with you. I'll go over these each week, and we'll post them on the website under the school information. So I'll pull up my presentation for today. There's some things I meant to go over last week and it just slipped my mind, and then there's been a few updates since then, so we'll go through this as usual, and then at the end I'll open it for questions and answers. And then at the end, if people want to stay on and have time, we can even open it up to those who have already started back at school to share their experiences. So some updates on masking. There were some questions about chiropractors, if chiropractors were allowed to fill out exemption forms for mask exemptions. The frequently asked questions for the executive order just says health professional, which is quite broad. One of our other medical directors in another health department did ask the governor's office, and they remarked that a chiropractor, and this was a cut and paste from that email, a chiropractor is not qualified to make the type of diagnosis needed for mask exemptions. So I do have that email if you need that to back up any arguments, but that was the official declaration from the governor's education policy person. I've gotten, I've gotten calls from more than one school now. We have an allergist in Cadillac who has some different opinions about COVID and about masking, and has been pretty liberally giving out exemptions for masks and face shields, so stating that people cannot wear either. I was on a call with all the medical directors in the state this morning, and there have been some other physicians in the state who have similar behaviors. I did call his office this morning, pretending to be, well, I am a mother, but pretending to be a mother of a student who just didn't like to wear masks and wanted to get an exemption form. They said that the child did need to have a legitimate medical reason. They seem more than happy to give me an appointment to do that for me, but that I couldn't get one just because he didn't like the mask, that there actually had to be a legitimate medical reason. I do have an email out to Laura just to see if they have any other ideas. I know I've had other medical directors who said that they've suggested to schools they request documentation to prove the diagnosis. I don't think you really can do that. I don't think you have the legal authority to request medical records. I'm not quite sure how to guide you in this. I don't know. I know one school had mentioned that their policy is if you can't wear a mask, you have to wear a face shield. So if they're saying they can't wear either, it's likely within your rights to say that they need to be remote educated. You could state that they need to get the exemption from their primary care provider, not someone else. So, and the other alternative is you just accept it. So again, I'm not quite sure how to answer that. I am working on it to see if there's anything more I can do. But again, he does care for people with allergies and asthma. And so, you know, talking with the nurse this morning at his office, you know, those are the types of things that they're giving the notes for. They say is for asthma or skin allergies, where people react to the mask. So I will keep working on that, but right now I'm not sure exactly how to fix that problem for you. Making you aware of a new resource. I will include this. I have a slide at the end that compiles all the different resources I have for you this week. But Spectrum Health did launch a website, and they have some really great, very short, but very nice generalized videos for both students and parents, as well as educators and staff. They also have some handouts as well. So it's just really nice resources they've put together. They have a nice, really cute video for kids on masking. So just some additional resources there available for you that are really open to anyone who wants them. Contacts of contacts continues to always be a stumper for people. This image is actually from some resources from Oregon, which I'm going to share with you. They're really wonderful and really detailed, but just reminding us that if you have a confirmed case, close contacts need to quarantine, but contacts of contacts do not need to quarantine unless they've been in contact with the case themselves. So just as a reminder, that is explained on page 6 of the toolkit and page 4 of the handouts that we've given to you. So if there's any questions among your staff or among your parents, feel free to utilize those resources. And I did actually put a scenario in there that explains that actual situation of, what that situation might be, and, why that contact of a contact doesn't need to be in quarantine. So just a reminder on that. Travel was something I forgot to bring up last time, and someone asked at the end and reminded me that it had slipped my mind, so better late than never. The CDC changed their travel recommendations on the 10th. It's not as simple and straightforward, unfortunately. So previously, if anyone had traveled internationally, when they got back in the US, or if it was an international individual, if they came into the US, they had to be quarantined for 14 days. Blanket statement, it was nice and simple. Now it's really vague and difficult to understand, but they're saying that if you come home from travel, basically any travel, you should take extra precautions like staying home if you did anything that was higher risk. So if you went to an area with higher levels of COVID, if you were in a large social gathering like wedding, funeral, or party, if you went to a mass gathering event like a sporting event or something like that, if you were in crowded areas, or if you were on a cruise, then you should stay home for 14 days. For international travel, if you went to a country with higher levels of COVID, you should consider staying home for 14 days. And the best place to determine that is if you go to this website. The map is colored in different colors, but the top list is the list of level 3 COVID-19 risks for high levels of COVID, and it lists all the countries by alphabetical order. The other thing you can do simply is just say, if you have international travel or you took a cruise, you need to be on quarantine for 14 days. You certainly can just continue to say that to make it easier for you. The issue is that there are a lot of countries who have lower COVID rates than we do, so it's a little bit tricky. But just an update, this is the official guidelines now. We do still get questions about domestic travel, and we recognize that many other states have recommendations for quarantine after travel to certain states, because many other states have much worse COVID than we do. Our state and our health departments do not have an official guideline to recommend quarantine. I know a lot of the medical directors were talking about that and hoping to get some official guidelines. However, if you and your HR department or any other organization within your school system feel like you need to have that safety net that people are traveling, especially as we get to holidays, to areas like Florida or Texas or other areas that have really high rates of COVID, I did search and find a resource that can give very good guidance as to what areas you would consider high risk if you wanted to make those policies. Again, this is not an official recommendation. I'm not recommending you do this necessarily. But if you decide that you want some kind of policy, this globalepidemics.org website has a great map. It lists both by counties and by state, by color, and the states or counties that are orange or red basically have high enough spread that it would be essentially equitable to, say, the level 3 countries. So again, if you were trying to set a policy like that, that would be a resource you could use. But again, this is not an official recommendation from your health department. It's just, if you're looking for guidance, there is some guidance. Hearing and vision, one of my district's hearing and vision supervisors just wanted us to remind you and let you know that certainly there have been delays with getting hearing and vision screenings done. They are working on an executive order to help with that process, but just to let you know that there will be leniency in the reporting deadline of November 1st, that you should not exclude kids from attending school if they haven't had their hearing or vision screenings. So she asked me just to pass on the FYI that there will be some orders and things coming out about this, but just to know that you're not going to need to worry about this, and to know that there will be leniency about these requirements, because she had said there had been some questions and concerns. I don't know a whole lot about that other than this, but just to pass that along to you guys. This is really busy, and actually we're going to share a guide that came out from Michigan Department of Education. It's not on their webpage, but it was sent to one of my environmental health directors. And so we want to make sure and get it out to you guys. But I recognize that most of the guidance in the roadmap for school lunches were recommendations, not requirements. And so we want to make sure that we really emphasize the importance of appropriate safety measures and distancing during lunches, because that's a high risk time. Kids will have their masks off, they'll be talking, they'll be eating, and so that's a really high potential for germ spread. Also recognizing though that you don't have a lot of extra room to space people. So just some guidances here to try to use, if you can't prevent kids from sitting across from each other, to try to put plexiglass up, to reduce your capacity in your cafeteria, to stagger lunches, to really work on keeping kids more than 6 feet apart from each other. Again, we will send out something that the Department of Education just sent to us. There's also a guidance document from the state of Washington, and I will have this listed at the end with the resources. That's really, really good. It was actually listed in a set of resources from the state. It's kind of buried on their website, but it has a lot of really excellent recommendations, both for how food service operates and also ideas for how you serve food and how kids eat in the cafeteria and things like that. We've been getting questions too with handling symptoms for employees and with students, because we know there's so many variables and scenarios, it's really tricky. The CDC states, and it's in the frequently asked questions sections of their employer-employee section, that if employees have symptoms of COVID, they shouldn't return to work until they've met criteria for discontinuing home isolation. So they don't really say, or if they have a negative test. So it's really tricky, because there is always that chance that if someone has symptoms and a negative test, they could be a false negative. And I think a lot of other school systems as well, looking at other states' guidances, really do have recommendations to keep people out for 10 days to err on the side of caution. However, recognize that you'll run out of teachers and students pretty quickly if everyone with a sniffle is kept out for 10 days. So just as a reminder, we really look at the major symptoms or 2 minor symptoms. Realistically, it's kind of up to you. If staff have pretty minimal symptoms, if they really don't have any identifiable risk factors for COVID, if they're in low risk areas, they're not going to outings, they're not traveling, they've not been exposed to anybody, they're feeling better, their test is negative, it really is up to you if you want to let them come back before those 10 days. Remember, these are guidelines, these are toolkits for you. This is not a law, this is not a rule that you have to follow. So I know this is something we've gotten questions about, so I just wanted to reiterate that. The state of Oregon came out with some nice flow sheets that are really, really detailed. I will mention them again at the end as one of the references. And they really go through things very detailed. So that may be something you may want to look at if you really want something that's going to really walk you through step by step and not be so vague and so open-ended. So as students, again, remember that the main symptoms of concern are fever, sore throat, a new cough that's uncontrolled, causes difficulty breathing, diarrhea, vomiting, abdominal pain, or a new severe headache. The other symptoms, there's a whole lot of other symptoms. Those are all still pertinent and really based on your level of concern. So if you're seeing a lot of activity in your school of COVID, that there's been a recent event where a lot of students were exposed, certainly you can send kids home or have more caution based on the other symptoms as well. According to our flow sheet that we have that's based on the CDC recommendations, really the requirement to have testing prior to returning to school or the need to have them finish a 10-day isolation is then taking into consideration, are they at high risk for COVID? So was there a chance they were exposed to COVID? Are you having higher amounts of COVID in your area? Did they travel somewhere? But that's being on the less cautious side. You certainly can say, you know what, we're just having concerns or we don't want to take any risk, and you can certainly require that kids get tested or stay out for the 10 days. Again, looks like I didn't finish my full sentence here on the bottom, but the flow sheets I'll suggest from Oregon really walk through carefully. So basically they'll say, if you've not had an exposure, if you have a respiratory symptom, you should really stay home the 10 days. If you didn't get tested or have a negative test, if you have one of the more minor symptoms and there's a different diagnosis available, you can come back. So it gives you a little bit more specific guidance for those different situations. One thing I forgot to send out last time, I know one of my health departments did, and I think two didn't, and it was mainly just because I didn't give it to them to send out. It's been a little bit hectic, but the template letter that I promised for your use if you had a case in the schools. And I know that question did come up in one county recently, was about notifying schools or districts if there were a case. So just as a refresher, the plan is if you have a case in the school, you will have a template letter you can use. We also can provide a letter on our letterhead if you prefer, but that letter can be sent out to the families in your school to let them know that a case has occurred. If you wish to notify the entire district, you can do that, but realistically, the main people that need to be notified are just the ones within that school. And if the individual played in a sport or was on a certain bus, obviously those individuals should be notified as well. The Oregon information that I keep mentioning, one of their packets has other sample communication letters, and there's a communication work group that had a toolkit earlier this summer that they released as well. I will send out the Michigan Department of Education meal serving options and considerations when returning to school, as I already mentioned. The Oregon school scenarios, I didn't edit this. I actually decided not to send those out since they are quite long. I have the links to those on the next slide. And I will send out the copy we just went over of the positivity and the rates of illness. So the recommended resources I have listed here. So Oregon has a really detailed, it's kind of their version of our roadmap. However, it's extremely detailed and it just gives a lot of really good information. Keep in mind, some of it is fundamentally different. They're much less strict about masking and some other things, but it just walks through things really in a really detailed way. The second two things I think will be most useful to you. I take that back. The third thing is like our roadmap. The first two things I think will be the most useful for you. So the first one talks through basically any scenario you could think of. So, student was exposed in school, student was exposed out of school, student had symptoms and had been exposed, student has symptoms and wasn't exposed. And so, it goes through just tons of different scenarios. And then the second thing listed there, the one in the middle, are really colorful flow sheets going through every single scenario. And I think there's 7 different scenarios and there's A and B. So there's probably about 14 different scenarios and flow charts there. And it explains, if this happens, see scenario 4B. So it's really detailed, and it's pretty easy to follow if you walk through it as it explains. The one here, the interim COVID-19 cafeteria and food service guidance from the state of Washington. Again, just very nice information on food service and serving food and safety for that. And then the Spectrum Health school resources are listed here. So I know it's a lot of information, so we'll get this out to you with the links. And then I mainly added these things here just so I had a list of things that I needed to do so that I didn't forget to send anything to you this week. So with that being said, I can stop sharing my screen here. Well, I will continue to share just so that I can pull things up if I need to. But I can stop talking now and we will open it up to questions.
Okay, it looks like we've got some questions in the chat box, so we'll start with the first one that came in, and it looks like it says, if a school is teaching in cohorts with the teachers changing rooms, not the students, do the teachers need to put a new mask on each time they enter a new classroom?
No. The main reason like healthcare providers are encouraged to change masks between patients is because they're working with known sick infectious patients. And so it's to decrease the amount of germs that might be on the outside of their mask. So when you're working in a building with people that should be healthy, that you don't have suspicions of all being sick, you do not need to change your mask.
Okay, and Dr. Morse, we can still see your screen. I don't know if you want to stop sharing.
Okay, yep, I'll stop, and then if I need to show anything, I'll...
Okay. So the next question says, hello, my name is Andrew. I'm a parent of students in K through 5 classrooms. Our school is not requiring masks in rooms, even where social distancing is not possible. And even though a majority of our teachers in those rooms have indicated on a survey that they want masks worn for their safety and the safety of their students. I have asked our superintendent about this, and I was told that she did not read mask research. She follows the guidance of our local health department on best practices. I spoke with our local health department. They told me they do not create guidance. They follow the guidance from Jennifer Morse. So my question is, what is your guidance for best practice for K-5 classrooms? Why would we not guide superintendents to require masks, just as the governor and her medical experts urge superintendents to do on television?
So I have said many times on these talks that it is best practice to wear masks as much as possible, no matter the age or whether you're in phase 4 or phase 5, that the roadmap gives you allowances, that if those K through 5 kids are always and only with their own class, they can remove them. And understandably, it's more difficult for them to wear their masks, but the safest, and I think I said this just last week, the safest thing is always to mask. The teachers, it clearly says in there that all staff must wear their masks at all time except for eating. So I don't know how anything that has been said here can be misconstrued, and I don't know how that can be misconstrued. So if you want to email me or something, we can see what we can do, but I'm pretty darn sure, and I can go back to my video last week, but I'm pretty darn sure when we talked about the younger kids, I said that it's always safer to mask than not mask.
Okay, and Dr. Morse is contact information, I think, is on your presentation, right? Or if you
It's
want to.
not this week, but it's JMORSE at DHD10.org. Yeah, we don't set rules. Michigan Department of Education, MDHHS sets the rules, but we give guidance. But the rule about staff wearing, if you're in phase 4, staff is to wear masks at all times except for eating. So if you're in one of the more northern counties and in phase 5, so if you're in that Grand Traverse, the region 6, you're in phase 5. So I think it's only a strong recommendation that your staff wear masks, but still, it's always safer to wear a face covering than to not, regardless of what the roadmap says.
Okay, thanks, Dr. Morse. The next question, what rationale is most often provided for receiving a COVID test?
You mean the indications for testing, I'm guessing? So indications for testing, first of all, am I still sharing my screen, Janine? I can't tell if I turned it off.
No, you're not.
Okay, thanks. So indications for testing are having, according to the Infectious Disease Society of America, which is the clinical recommendations, having any symptom of COVID, being a close contact to someone with COVID, and then there's other recommendations such as, prior to having surgery, being in a high-risk group such as like nursing homes, jails, homeless shelters, things like that. But the top two are having any symptom of COVID and being a close contact. Although that gets a little tricky because if you do it too soon, it could be falsely negative. If you're symptomatic, it's not really essential because we consider you a probable case then. And if you're negative, it doesn't mean you can get out of quarantine. And unfortunately, a lot of people think that if it's negative, then you don't need to be in quarantine any longer. So I'm not sure if that answered that question, if that was what the question was asking.
Okay, well, we'll move on, and if not, then let us know. Next question says, if a staff member states that they have traveled out of state recently, can they come to work? We have staff who have been into Wisconsin, Indiana, and Florida this week. Right.
So again, there are no official guidelines or recommendations to not allow them to come to work because it's very tricky. Some travel within the state of Michigan would be comparable to travel to some areas out of state. So it does get extremely difficult to make those rules and regulations. However, if you as an organization feel that some travel out of state is high enough risk to put restrictions on it or to put quarantine on it, again, I gave that link to a site that lists, and it even goes by county. So even if you wanted to try to follow the risks of different counties within the state, areas that are at very high level of transmission, so that you could state, if you go to an area that is, at this level per this website, then you'd need to be in quarantine for 2 weeks. The problem is it changes, week by week it changes. So you'd have to have a pretty adaptive policy to that. But long story short, again, people's behaviors and travels within the state can be just as high risk as traveling out of state. So it gets very challenging. And that's why we've not made official rules. And I'm pretty sure that's probably why our state has not made official rules.
Okay. Next question. We are getting some questions from employees regarding family members that may test positive. The employee would need to be out for 14 days from exposure, but since they live with the positive person, does that 14 days start when the family member was diagnosed?
So the 14 days starts from the last day they were exposed to someone who was contagious. So let's say it's the student and their mom is the one who's sick, and mom became symptomatic yesterday. She actually started being contagious 2 days before that. So she became contagious on the 24th. So if mom found out she was positive today and mom was able to sequester herself away from everybody in another room and not be around the student, she would be off for 14 days from today. If mom didn't get her test results for 10 days, it'd be 14 days from then. If mom could not separate herself from the student, so the student was around the mom the entire time, mom would be contagious for 10 days past the start of her symptoms. So if her symptoms started yesterday, that would be like September, my math is bad right now, 6th or something. So let's say mom stopped being contagious September 6th. Kiddo would be on quarantine then until September 20th, because it'd be 14 days past her last day of being around someone contagious. So it's complicated. If you have questions about it, we can help give clearance letters to you about when someone can come back, but it really is dependent on when was their last exposure to someone contagious. Someone else in that family may then also become, so like mom might be sick and then 10 days later dad gets sick, so now kiddo's date goes 14 days past dad's illness. So unfortunately, some people are in quarantine a really long time.
All right, thanks for that. Next question, why has there been very little, if any, effort to public education regarding mask wearing and social distancing? There are virtually no public service announcements via billboards, TV, radio, or internet informing people on how to behave in order to limit infection. I can speak to that as the Public Information Officer for District Health Department number 10. And while I haven't necessarily seen billboards, and I haven't necessarily seen any promotion on television and radio, I can certainly say that there has been a great deal of promotion about it on social media and other avenues digitally. I know that we post information quite often on our social media pages, in particular Facebook. So I also know that the state has just recently implemented a campaign as well, the Michigan Department of Health and Human Services. So hopefully you'll start seeing more of that publicly. Dr. Morse, is there anything?
And that's what because I've seen some, and I know it's tricky because I don't listen to the radio and I don't watch TV that has ads, and I know it's hard. I don't read the newspaper, and so I know it's hard for people. I know it's hard to market people anymore because it's trying to figure out what gets people's attention. But I do know from being on state calls that they are or have planned a large marketing campaign where they have planned masking billboards and TV ads and radio spots. And unfortunately, it may be that they really do target a lot of that towards the more populated areas rather than where we all live, which is less populated. And so that might be why some of us just aren't seeing it as much. But I do see things online and on the internet. I wish it was more. I wish we had a lot more positive messaging about it. But I think this day and age, it's hard to do it's hard to find that perfect way to get it out there.
Right. Mr. Bishop responded saying, but posting to social media is only seen by those people that follow those sites. Why aren't there PSAs that are likely to be viewed by everyone? Who do we pressure to do this? Again, as Dr. Morse said, when it comes to advertising, any ad that you put out there through any vehicle is only going to be seen in the event that somebody is watching at the moment your ad is on, or reading the paper at the moment in the issue that your ad is in the paper, or listening to the radio, the particular station, the genre, the moment your ad is on. So again, it's difficult to reach masses anymore because things are there's so many diverse channels to reach people now. So again, I think the efforts are there. I think they're getting beefed up more now. They're just starting to release a campaign, the state is. So hopefully you'll see more of that.
Yeah, I wish it was more. It is hard.
All right, let's move to the next question. What is the safety plan for our band to play inside on poor weather days? We have a large enough space for proper social distancing and special masks to play instruments. Should we allow it? Some schools are banning playing in the building.
So the National Federation of High Schools has done some really fascinating research about things like that, and they really did show that if you're using a bell cover and proper masks and things like that, the risk is relatively low. So if you or your instructor haven't looked through that, I'd encourage it. I admit, just because of my time limitations, I haven't been able to read all of it, but it had very promising information and very, very logical recommendations, and they certainly were not to not have music or bands. So as long as you can distance and use masks and, cautiously empty spit valves and things of that nature, I feel that it is something you can do. But again, I would encourage you to look at the National Federation of High Schools information, because they have extremely detailed information and really very detailed research that they've done to back that up.
All right, next question. Related to the CDC travel recommendations changing, is the health department going to continue to require a 14-day quarantine for their own employees who are traveling internationally? So I don't know if Steve Hall or Kevin Hughes or Marcus, if you want to jump in and answer that.
Well, I'll just start by saying I don't know that we have a lot of people that travel internationally. And I honestly, they might not know about the travel changes just because I haven't forwarded that to all of them yet. So I'll give them a pass. I'll give them a scapegoat if they don't know about the changes, but it's likely something we just need to put to our HR people. But yes, I'll let our health officers jump in here if they're on the phone.
Hey, Janine, this is Kevin. Well, no, this is Kevin. I am here, but I was on another call, multitasking. Can you repeat the question?
Absolutely. It says, related to the CDC travel recommendations changing, is the health department going to continue to require a 14-day quarantine for their own employees who are traveling internationally?
At this point, I can only speak for District Health Department number 10. At this point, we are continuing to do that. That's not to say that that won't change in the future. But as of right now, yes, we are continuing to do that.
Okay, anybody else want to jump in, Steve or Marcus?
This is Steve. I would think we would do the same.
So you will continue to require a 14-day quarantine if an employee travels internationally?
Yes, that's our current policy.
Okay. Okay, next question. The question has come up several times. Are Clorox wipes sufficient for cleaning spaces if teachers have them? And can students use Clorox wipes to clean their spaces items without the use of gloves?
So the ingredient in Clorox wipes will kill coronavirus. So it is a sufficient cleaner if you follow the instructions and use it as directed. The CDC website states that children should not use or be around cleaning products. However, I was on a state call on Monday and they had said that they've gotten calls about how the roadmap states that janitors need to be in full PPE for cleaning, which is really not correct, and how they've gotten calls about students cleaning. And so the state might come out at some point with guidance to allow students to clean. Off the record, I have said that I don't feel there's an issue allowing students under supervision to use things like Clorox wipes or others to clean their areas as long as they wash their hands right afterwards. However, because of things that the CDC has posted about not allowing students to come in contact with cleaning products, you just need to be aware that is there, separated in its own little box, so that if parents see that, they might have issue with it. So I just put that warning out there.
Okay, next question. If a teacher is in a classroom alone conducting a virtual lesson, can they remove their mask?
So in this situation, I know we've had questions about that before, because the roadmap says you must wear your mask at all times except for eating, while other guidances state that as long as you're more than 6 feet away from someone, you can remove it. Realistically, if you are in a room by yourself, you can remove your mask. So yes.
Great. Okay. Next question. Can you please advise school nurses on the PPE requirements for when they come in contact with someone who has COVID symptoms? I have heard the use of only a surgical mask is acceptable, but also heard that full PPE is required, like N95, gloves, gown, face shield. Just need some clarification.
Mm-hmm. So an N95 mask is really only required if you're performing what's called an aerosol generating procedure. And even that has been questioned in recent research, but an aerosol generating procedure in a school setting should only be providing a nebulizer treatment. And right now, if you have students who have needed those, you should really try and communicate with the families and the doctors and see if you can get kids switched to just needing inhalers in school. So really, the need for anyone to have an N95 in the school will hopefully be none. Definitely, if your staff feels safer having one, that's always an option. They will need to be fit tested. You'll need a respiratory policy, so it's pretty complicated, but it is doable. If you have staff or nurse working with someone with COVID symptoms, they should ideally be wearing a medical grade surgical or procedural mask, eye protection, which is a face shield or goggles that wrap around the front and sides of the eyes, gown and gloves. If that's not possible, if they can at least wear a medical grade surgical mask and eye protection and then wash their hands afterwards, that's ideal. So on the National School Nurses Association website, they have a guide for PPE recommendations, and that was also included in my list of resources on the very first PowerPoint that I gave. So if you go to that first PowerPoint, in the last 3 slides, I think, had a bunch of links, and that was one of them.
Okay, thanks, Dr. Morse. Next question. Yep. I've been hearing lots of talk about teachers being labeled as, quote, critical infrastructure workers, which would possibly make them exempt from quarantine requirements. Is there any truth to this, and what is your recommendation regarding this? They could possibly be quarantined over and over again.
So, or Steve and Kevin might be able to help me. I know I read the press release about that, but did they officially get added to that list?
I was going to say I've only seen that as a headline. I have not read anything on it, and to the best of my knowledge, there is nothing official related to that at this time.
Okay, I'm trying to search it right now.
Yeah, I'm the same as Kevin. I saw that headline that the White House was considering labeling them critical infrastructure, but I haven't seen anything official.
Okay, so I'm going to plead ignorance as to whether or not that has been done, but what I can do is tell you what that would mean if it were to happen. So we do this with our other critical infrastructure workers as well, so like police officers, EMS drivers, even grocery store workers are considered critical infrastructure, anyone who deals with food accessibility. So basically, anyone who needs quarantine really should be on quarantine. However, if someone who's considered a critical infrastructure worker were put on quarantine, and it would cause, this is how I perceive it, this is how I discuss it with my nurses when we're talking to employers, but if putting them on quarantine would cause their job and those that they serve jeopardy or hardship, then the risk of putting them on quarantine is greater than the benefit to society, basically. So, if we have subs available, we should put people on quarantine. However, I think we can all imagine there's going to be a point where we just don't have enough people. So the CDC does have a specific guideline saying if you're critical infrastructure and you have to work because your job needs it, you can keep working, but you have to follow these specific guidelines, which really are quite similar to what you would be following every day anyway. But it's just basically being extra cautious to watch for symptoms, to follow all the safety protocols of mask use, hand washing, and things like that. So, ideally, if you've been exposed, we do want you on quarantine, but if that's going to cause your kids to not have a teacher, then it's not worth the risk. And I agree with that, really, because teachers are critical.
Okay. Next question, in order to quarantine students at school, should there be 2 symptoms or only one of the listed symptoms in the toolkit? Is the temperature the priority symptom to remove the student from school?
So if anyone has a fever, that's extremely important, and that person really is a high priority to quarantine and get out of school. However, lack of fever does not mean that they don't have COVID. So it's meaningful if they have it, but it's not reassuring if they don't have it, if that makes sense. There isn't this magic combination of symptoms. I know it's really frustrating, and I was talking to someone yesterday about it. We have people that have horrible headaches, that have just a scratchy throat, that have vomiting and diarrhea. And so you're going to have to just use your gut really on this. The list for the students has those 5 biggest likelihood symptoms. It's for students, not 2 of the symptoms. That's for adults. But for the kids, it's those higher likelihood symptoms that you're looking for. But again, if they have one of the less likely symptoms, like a stuffy nose, it doesn't mean you're not going to completely rule them out if you know they might have had an exposure somewhere. So I can't necessarily give you a perfect answer on that. You're going to need to just use your gut. If you have a kid that never complains about anything and now says they have a sore throat, that might be more important to you than the kid that tends to want to go see the nurse every day and has a headache. So I'm sorry, I can't give you a better answer than that.
All right, next question. Dr. Morse, could you please clarify your response earlier about masks in K through 5? K through 5 students who are in a cohort are allowed to remove their face masks while in the cohort, so during their classroom time, correct?
Yes, so the roadmap says that students K through 5 who only interact with their own classrooms, so they're not having recess with other classrooms, they're not having lunch with other classrooms, that are only with their own classrooms, that when they're in their classroom, they can remove their mask. What I was saying is that wearing the mask is safer than not wearing the mask. And, picking the times when they take off the mask, such as quiet reading time, times they're not talking, is safest. To say, well, this is the 2nd grade, so nobody has to wear a mask, that isn't the point of that message. And it shouldn't be interpreted as that, if you're K through 5, you have no risk of COVID. That's not what that means. But yes, that is saying that according to the state rules, if you are K through 5 and you are not mingling with any other classes but your own, you can remove your mask. So that's what the rules say. And best public health practice is the more you wear your face covering, the better.
All right, and it looks like Kelly Conley provided a link to the state website with a lot of information about masking. Anyone can share this information with their staff, families, etc., as an additional resource. So there's a link there from the state website in the chat box. Okay, also Steve Hall, health officer for Central Michigan District Health Department, says the White House has had many PSAs on television featuring the Surgeon General, Dr. Birx, and Dr. Fauci. The state has also had a campaign regarding masks, and as mentioned, is launching a new campaign soon. So that's regarding promoting and advertising about wearing masks that he wanted to comment on. Steve also provided a link to an ad campaign that was featured in MLive. Steve, is there anything you wanted to mention about that?
No, that just describes the new campaign that the state's starting, a $5 million campaign in regards to stopping the coronavirus. That's what that article is about.
Great. So there's a link there to that article that might help answer some questions. Next question. With Isabella County's 197.8 per million and in the highest risk category, what would that number have to get to adversely impact schools?
And I'll let Steve jump in after me on this one. That number ordinarily would be quite concerning to our public schools. However, those increased cases have been entirely isolated to students at CMU. And again, the likelihood of, we're not seeing, that I've been made aware of at least, we're not seeing spread to non-CMU students at this point. So the likelihood of those additional cases that we've seen just in this last week of impacting public schools, the teachers, their families at this point is low. We watch that though. So if in a week we're starting to see secondary, tertiary cases in other people that's going to infect or affect public schools, that would be different. So that's just where looking at a number and making a decision is challenging. You have to look at that number and say, where are these cases coming from? So this has been a very specific outbreak linked to college students. So I don't know, Steve, if you want to add to that. I mean, if I know that number is high, but at this point, I don't feel that it affects really the public or the K through 12 return to school.
You know, I think you covered that well, Dr. Morse. And that's where this is a fluid situation. As Dr. Morse, I think it was maybe 2 weeks ago when we first introduced the concept of, you know, what would concern us. And one of those was the, you know, 5% positivity rate in the community and rising. And when you showed that document today and we saw 5%, obviously ordinarily we would be very concerned. But as Dr. Morse said, this particular outbreak and the number of cases is really associated with the return to school of the college students, and we can narrow that down to a few parties. So at this point, there isn't that concern in terms of the schools opening, but obviously that's something that we're monitoring very closely to see if we do get those secondary cases out in the community.
Okay, another question about masks. I would assume there is a difference between being allowed to remove a mask in K-5 by law and your guidance that masks should be worn by even young children as your best medical advice guidance for schools. Is that correct?
Yes, that is correct.
Okay. Next question, who would do a fitting for an N95? District Health Department or hospital?
Typically it's a occupational health clinic, and I have numbers, the Mid-Michigan Health Facility, their occupational medicine, which is out of their urgent care center, does that. And I think I had communications with one of my counterparts. I can get those phone numbers. We were looking at doing it, but we, at this point, obviously, were just a bit overwhelmed. And we called around our area occupational clinics, and they did not do that. Here we go. So Mid-Michigan and Covenant, that's more towards the central to east part of the state. If you're further north, you may want to call Munson and Spectrum and see if they have occupational medicine that will do that for you. And so I'm gonna, there you go. So there's the two that I know of that do it.
Thanks, Dr. Morse. Okay, next question. It's actually kind of a statement from Deborah Yeagley. We do have students with tracheostomies who have suctioning performed during the school day.
Okay, I'm sorry. I didn't, you know, I think my traditional K through 12 schools, and I really should be thinking about our RSDs and our other institutions as well. So you are right. Those are definitely aerosol generating procedures. You are right, Deborah. I'm very sorry for not thinking about those things.
Okay, so it looks like I've gone through all the questions in the chat box. Does anybody have any other questions they'd like to add, or if you want to unmute yourself, you can ask them?
And also, for those who have the time, if anyone has started back at school and wants to share any experiences, I think that would be a great thing to do too.
I have a question. This is Steve Scoville from Farwell, and it relates to just keeping the loop closed on the communication between the health department and the schools. If a family member is told that they need to quarantine as a result of an outside contact with COVID, is the school going to be notified of that as well? Or are we going to rely on the family member to share that information with the school?
So that came up in discussion with one of my other districts. And so I created a form, trying to see if I can pull it up here and show you. I created a fillable form so that we could share that information with you. I've shared it with my other two districts, which includes your school. I just need to follow up with them and make sure that we're on board to do that. Here, let me share my screen so you can see what it looks like. One concern that we had was just that, you know, confidentiality and things, but I found what I felt was a good enough part of the public health code that allowed us to share this information. However, we'd ask that you just keep it with that part of your staff that needs to know it, likelihood your secretary or your school nurse. So our thought was that we would basically put in whoever we knew that should not be in your school, whether it's because of isolation or quarantine, and then the earliest date they'd be allowed to return. So again, as we talked earlier, you know, they might have to be out longer, and we might not always know that. But if we do know the dates change, we'll update it. So there's a spot here for the date of update, and we can extend it. But yeah, that concern did come up earlier this week because we had some students that were out on quarantine because of a non-school event. And we thought, gosh, what if they don't stay home and they do go to school, and who's supposed to know about that? So that is the plan. Just be patient and know we might not always know who everybody is. And, you know, our nurses might, some things just fall through the cracks, but we'll do our best to keep this up to date and keep you posted of those things. And if you ever have questions, you know, you heard the grapevine that someone wasn't supposed to be in school, call us and we should be able to find that out for you.
That would be very helpful. Thank you.
This is Jeff Wright from Pewamo, Westphalia, and we're the school that Dr. Morse is referencing. It was prior to us starting school. Our first day of school was on Monday, but on Sunday morning, my phone's blowing up because there's rumors that we had a potential positive case. And the health department was great to work with, communicating with myself, doing the research on the families. Got back to me, or I don't remember if I called them first thing Monday morning, gave me the list of students who needed to be out and the date that they could return. So then the generation of this form is going to be really helpful because we had to make sure who was in school on Monday as we started our attendance and who was supposed to be out. But the health department was great to work with as we worked our way through that process.
Thank you for sharing that. Does anybody else have anything they'd like to share about your experiences as if you guys have opened your schools back up and how things are going?
I can go ahead and start since I already started talking about experience at PW. First, it is great having the students back in the building. 163 days without students in the building is way too long. We have about 95% of our students who return face to face. So the others who want to learn virtually, we're going to start those people in a couple of weeks. But just having the people in the building, Mask wearing, we talked about the importance of wearing a mask, and it's about 10%. We wear the mask because it's the law. The other 90% is because we're concerned about others. We wear the masks not just to keep ourselves safe, but those around us and our staff members or other classmates who have situations at their households where they need to be protected, and that's why we wash our hands. The most difficult task that we're dealing with is the physical distancing, which is impossible at school. The kids try. Well, the middle schoolers think they're trying, but it's too difficult for middle schoolers to not be around each other and to do the mob pileup. But it's gone really well because the students want to be here. So they're willing to listen and work together because they know that it can be snatched away at any moment's notice. So we just finished our 4th day, or we're within a half hour of finishing our 4th day. So it's gone fairly well. Even the teachers, and rightfully so, they have a range of emotions about being back. They're excited and scared of what it's like to teach with a pandemic facing them, and then also what it's like to teach no longer with project-based learning and group work. It's more individualized and more lecture. But I think that will start to change as we go further in the process and begin to feel more comfortable with our settings and surroundings. But again, the first thing is, it's been great to have the students in the building.
That's great.
Thank you for sharing that, Jeff. Anybody else?
And if anyone wants to give me a call or send me an email about, hey, Jeff, what are your major learnings? What have you done? What have you needed to do differently, such as lunch and the process of going through the lunch and how we handle the lining up and the processing and eating. I won't go into all those details, but if you have questions, more than willing to talk about that process here at PW.
So Jeff, Michael Bishop says, Jeff, I loved your comment regarding the fact that we wear masks to protect others, not ourselves. That is the message that needs to be hammered to the public.
Yeah, absolutely. And our kids have embraced that, so our student leadership at our elementary school and here at the middle school, high school, they have absolutely embraced that. It's been neat to see how that's taken place. They take mass breaks, and one of the locations is outside my office, and so I can see them standing around and being 6 feet apart. Of course, there's much relief when it's 93 degrees outside and we're in school. I don't know who didn't call school today. Geez, that superintendent's nuts. But to watch them be able to take their masks and hang out together for even just a couple minutes. So it does feel good to see our student leadership taking ownership of that.
Okay, anybody else want to share? Last call. Any other questions? Okay, it sounds like we're good for the call today. We thank everybody. And as usual, we'll have Dr. Morse's presentation put up on our website, and we'll get the video or the recording of this call loaded as soon as possible. It will probably be up there sometime tomorrow. It's a process to get it downloaded, then loaded onto YouTube, and then have the link available. So we'll get this call loaded up as soon as possible. Thank you, everybody. So Doc, you can stop recording if you want to. I think it's you.
There we go.